So my name is Dr. Molly. I'm with Your Goals Physical Therapy, and I set up a poll, and people were kind of interested in runner's knee. So I'm going to kind of talk about that. So runner's knee is kind of the pain that you get in your knee, right, from like after you're running or while you're running. So it can be anything from a dull ache to something that's kind of sharp. But obviously, by the title of it, it's impeding your ability to run at the distances that you want. So some people go to the doctor, but they're just really curious what it is and why it's stopping them from running. So they've stretched. Many people that come to me, they're like, I stretch all the time. It's not helping. It doesn't help for long term. I get... it hurts when I get up from a chair after a while. So it starts to kind of bleed into other parts of their life, but they really, really want to be able to run. So the thing is that it's probably not actually your knee. So it's probably coming from either your hip or your ankle. Your knee really only does one movement, right? It's a hinge. It just flexes and extends. But the joint above it and below it do a lot of dynamic movement. So sometimes it's a little bit more tricky than you just need to stretch, your quads or your hamstrings. Sometimes you need somebody to watch you walk or to do kind of a body screen assessment to find out what else is going on. Because it could even not even be on that side of your leg, right? It could, or, if it's your left knee, maybe it's your right side that's actually causing something to happen to your knee. So on the opposite side. So let me just tell you a little bit. So I have a story, right? So I had this guy, Sam, who was in his early 30s, who was, just starting to work out. I guess, he'd been sitting at a desk job for a little bit and decided that he wanted to start working out. And the easiest thing to do was obviously to go run, right? You can get up early in the morning and you can go run. Well, he was so excited because he could finally get to about 2 miles. I mean, how awesome. I mean, that's always a nice milestone, right? When you can get up to like 2-3 miles, that's impressive. But he started to have just this nagging ache in his knee by the end of that second mile. And then it was progressively getting worse, right? Then it was by the first mile. So he would take a week off and let it rest, thinking he just needed, maybe he'd overdone it. And he looked up all these stretches. So he was doing all, hamstring stretches, quad stretches, calf stretches. He was stretching everything he could think of. So he went back after the week, and it was just something that was sort of nagging. And he's like, well, maybe I'll just push past it. So that didn't help. And anyway, so pushing past it didn't help. He ended up finally going to the doctor after, this is like something that's lasting like 6 months, and he's getting really frustrated. And of course he's 30, so he's very paranoid that he's going to have surgery or there's something really wrong, because why wouldn't it just go away with resting it, ice, stretches, right? So he gets to a doctor that actually allows him to come to therapy before going to see an orthopedic surgeon or anybody. And so he comes in and he sees me, and we look at the way he's running. We look at what's happening at his hip. We look at what's happening at his ankle. So, watching him walk with and without shoes. I was able to watch him walk. Later on in treatment, we watched how he ran to see if there's something going on later on in his stride. But by the end of our eval, he was already feeling better because he knew that it was what it was from, right? We were able to identify a problem and something that we could work on and then come up with a plan for that. So he's already coming off oh my gosh, I'm going to have a total knee replacement, already, not having to worry about having to have a cortisone shot, and just a lot of anxiety you could just see just sort of came off of him. So we worked together. We came up with our plan. We worked through that plan, and I got a text message about 6 months later after we got done working together, and he had finally finished his first 5K with no knee pain. So it is possible to find out what is actually going on without having to worry about several trips to the doctors or cortisone shots, which is obviously a very scary process. So if this information was helpful, please either like or put the little heart emoji. Please share the information with your friends or family or somebody that's struggling with this. I would love to talk to people about this. I love questions. So by all means, if you have questions and you're seeing this after the live, then ask and I will get back to you. I will talk to you next Tuesday. I'll be doing another one. I will do another poll. Probably tomorrow I will set it up so it runs for a full week to find out what people are interested in learning about. If I did not answer any questions or I didn't get to the part that you want, by all means write in the comment section. I'm new to this, so I'm sure I will get better at giving you guys the information that you actually want, but any kind of feedback would be very helpful. So you guys have a great Tuesday. If you're in Houston, I hope you're bundled up because it's like freezing outside and we had snow this morning. So, so you guys have a good evening.